Assalamu alaikum. I am Dr. Shahjabeen. Dear students, you know very well that our heart has a special ability for generating rhythmical electrical impulses, that is autorhythmicity. These electrical impulses are conducted to whole heart through specialized excitatory and conductive system. In turn, that system causes cardiac contraction. So today's lecture topic is about that conductive system of heart. These are lecture objectives. At the end of the lecture, you would be able to describe the components of conductive system of heart, discuss SNOD as a pacemaker and the phenomena of overdrive suppression, describe the SI node location and spread of impulse from SI node to atrial fibers and then AV node. Discuss the AV node location, the delay in the impulse of AV node and the causes of this delay. Explain the functional significance of the slow conduction through this AV node. Describe the conduction of impulse through bundle of His, its branches and rapid transmission through Purkinje fibers. Describe the conduction speed and time taken by cardiac impulse from SI node to endocardial surface. And you would also be able to discuss the abnormal and ectopic pacemaker activity. Conductive system of heart consists of specialized fibers of heart with autorhythmicity present at SA node. Interatrial tract, that is the tract between the two atria. Internodal pathway, that is the tract that is between the two nodes, SI node and the AV node. Then comes the AV node. Here you can see this is the atrioventricular node, AV node, and the sinus node. These are the internodal pathway, the pathway between the two nodes. Then comes the AV bundle of His. This is AV bundle of His, and then its left and right branches, and at the end subendocardial plexus of fibers known as Purkinje fibers. The part of the heart from which rhythmic impulses for heartbeat are produced is called pacemaker. Sinoatrial node or SI node is the pacemaker of our heart. And normally SI node is responsible for generating the electrical impulses that bring about the mechanical activity, that is contraction of the heart. SI node acts as a pacemaker because the rate of impulse generation by SI node is the highest. SI node has the fastest rate of autorhythmicity and due to overdrive suppression phenomena. This slide shows you the normal rate of action potential discharge or rate of impulse generation by the autorhythmic tissues of the heart. In SI node or sinoatrial node, 70 to 80 action potential or impulses per minute, in AV node 40 to 60, and in bundle of His and Purkinje fibers 20 to 60 impulses per minute. From here, it is obvious that the highest or fastest rate is of SI node. The potential pacemakers like AV node, bundle of His and Purkinje fibers are capable of impulse generation, but as long as their firing rate is driven by SI node, their own capacity to spontaneously depolarize is suppressed. Look at below. Look at the analogy that shows how the SA node drives the rest of the heart at its own pace, or you can say rate. Suppose a train with 3 engines, like here SA node, AV node and Purkinje fibers, and many cars. Here are these contractile working cells. Engines are capable of moving their own, but the other cars must be pulled. One engine, SA node, can travel at 70 miles per hour on its own, AV at 50 miles per hour and Purkinje at 30 miles per hour. If all of these are joined together, the fastest engine will pull the rest of all engines and the cars. The slower engines cannot assume their own slower rate as long as they are being driven by the faster engine. So the fastest engine will pull all the cars and engines. In our conductive system, which is the fastest engine? Yes, the SA node acting as pacemaker. SA node is a small ellipsoid strip of specialized cardiac muscle cells located in the superior posterolateral wall of the right atrium. You can see right atrium, posterolateral wall, just below and slightly lateral to the opening of superior vena cava. This is superior vena cava, the yellow colored SA node. Now, spontaneous, rhythmical, electrical impulses arise from SA node and spread in all directions. First, spread throughout both the atria, primarily by gap junctions and secondary by specialized interatrial tract to the left atrium. Interatrial means between the two atria. There's the blue colored one. Just to ensure that both atria become depolarized to contract simultaneously. Then the impulses spread to the next node, atrioventricular node, through internodal tract or pathway. Internodal means between the two nodes, SA node and the AV node. And these are specialized anterior, middle and posterior conducting bundles, named after the scientist. Anterior one as the anterior internodal bundle of Buckman, middle internodal bundle of Wenckebach, and posterior internodal bundle of Thorell. Do remember, as atria and ventricles are structurally connected by electrically non-conductive fibrous tissue, so internodal fibers or tract is the only way to spread impulses from atria to the ventricles. And the velocity of that cardiac impulse from the SA node to the atrial muscle is 0.3 meter per second. But in the specialized internodal pathway is faster. It is around 1 meter per second. And the impulse after leaving SA node takes 0.03 second to reach the AV node. And this is the revision slide as you have done in the previous lecture. Sympathetic stimulation increases the permeability of SA nodal fibers to calcium. that leads to increased rate of impulse generation and increased excitation of conductive system. Here is the sympathetic nerve effect. This is the normal one. Parasympathetic, while increase the permeability of SA nodal fibers to potassium at the repolarization stage, leading to reduced rate of impulse. You can see this bradycardia and reduced excitation of conductive system. Atrioventricular node or AV node is located in the posterior wall of right atrium, immediately behind the tricuspid wall. You can see here on the right side of the lower part of the atrial septum, on the posterior wall of right atrium. Do remember, AV node is the only point of electrical contact between atria and the ventricles. Look here, this is the electrically non-conductive atrioventricular fibrous tissue, the gray colored, between the atria and the ventricles. The action potential or impulse is conducted relatively slowly through the AV node, known as the AV nodal delay. Look at the diagram showing internodal pathway. Look at here, these are the internodal pathway, anterior, middle and the posterior one, three pathways or tracts. Then AV node, this is the AV node, and this red colored is atrioventricular fibrous tissue, and in the center is the penetrating portion of AV bundle, yellow colored. Now, due to the slow conduction in the AV node, there is a delay of 0.09 second in the AV node before the impulse reaches the penetrating portion of the AV bundle. This is penetrating portion. Afterwards, there is a delay of 0.4 second in the penetrating portion of AV bundle. Here. So 9 plus 4, that makes a total delay of 0.13 seconds in the AV node and AV bundle system. We have done earlier that there is a delay of 0.03 second from the sinus node to the AV node. Now add this 0.03 to the 0.13, that makes total delay of 0.16 second, the time that takes the excitatory signal finally to reach the contracting muscles of the ventricles from the sinoatrial node. The causes of this AV nodal delay are diminished number of gap junctions. Small diameter fibers are also present over there that conduct the impulse at a very low rate. Ionic channels per unit area are also less, as a result of which there is a great resistance to conduction of excitatory ions from one conducting fiber to the next. The ability of AV node to slow the rapid impulse is called detrimental contraction and has great significance. AV nodal delay is very useful as it allows time for the atria to empty their blood into the ventricles before ventricular contraction begins. This increases the efficiency of the pumping action of the heart. From the AV node arises a special conducting pathway called the bundle of His, named after German cardiologist. Look at here. This is bundle of His. After penetrating the fibrous tissue between the atrial and ventricular muscle, the distal portion of the AV bundle passes downward. Then the bundle of His splits into two branches which are called right and left bundle branches that lie on the respective sides of the ventricular septum. Now each branch spreads downward. Look at here in the diagram. It's going downward toward the apex of the ventricle. This is apex of the ventricle. Then divide into smaller branches, Purkinje fibers. These smaller branches in turn course sidewise like this around each ventricular chamber and back toward the base of the heart. This is the base of the heart. The ends of the Purkinje fibers penetrate about 1/3 of the way into the muscle mass and finally become continuous with the cardiac muscle fibers. The last parts of the heart to be depolarized are posterior-basal portion of the left ventricle, the pulmonary conus, and the uppermost portion of the septum. Purkinje fibers of the conductive system are very large and the fastest fibers. The cause is presence of highly permeable gap junctions, due to which rapid conduction through Purkinje fibers occurs, that ensure that different parts of the ventricles are excited almost simultaneously. This greatly increases the efficiency of heart as a pump. This slide shows the total time taken for the cardiac impulse to travel from the SA node to the endocardial surfaces, innermost surfaces of the heart. From the SA node to the AV node, it is 0.03 second. Then there is a delay of 0.13 second, so it becomes 0.16 second. Now from the bundle branches to the Purkinje fibers 0.03 second, and again from the Purkinje fibers to the endocardial and epicardial surfaces of the ventricles is 0.03 second. So the total time required for conduction from the SA node to the endocardial surface is 0.22 second. This slide shows the revision or summary of intrinsic cardiac conductive system. The cardiac impulse origins at SA node, extends to the atria and then through internodal pathway to the AV node. Yes, after delay of 0.16 second reaches AV bundle of His, then divided into right and left branches and spreads very rapidly through Purkinje fibers to entire endocardial surfaces of ventricle. The rate of production of rhythmic impulse at SA node is 70 to 80 per minute, while for AV node is 40 to 60 beats per minute, and the Purkinje fibers have rate of production around 20 to 40 rhythms per minute. Now some of the abnormal pacemaker activities. Remember the analogy? If for some reason, look above, if for some reason the fastest engine breaks down, SA node pathology, the next fastest engine, AV node, takes over and the entire train travels at 50 miles per hour. That is, if SA node becomes non-functional, AV node assumes pacemaker activity. Look at here below. Similarly, if second engine breaks down, the AV node, Purkinje fiber takes over the pace with much slower speed, 30 miles per hour. And what happens that SA node or atria continue to beat at the typical faster rate or pace. Ectopic means out of place. Occasionally, an area of the heart due to any organic disease or pathology. For example, Purkinje fiber becomes overly excitable and depolarizes more rapidly than SA node. See the analogy? Slow engine like this, the Purkinje fiber suddenly goes faster than the lead engine SA node. The abnormal excited area is known as ectopic focus and can initiate a premature action potential that spreads throughout the rest of the heart before the SA node can initiate its normal action potential. Thank you, students. This is my email address for your queries and the reference books names.